click on this concept of moving away from this sort of moral obligation, moral imperative to the business imperative. And for those that don't know, I kind of grew up in my career more on the provider side. And so I understand when you're talking about the complexities of making sure that we have access to care. I mean, there's a lot going on there right now. And I think that's at the heart of what you're talking about is this business imperative to figure out how to make it work sustainably, to have clinical research out in the community. I don't know that we can separate that from the healthcare access imperative. And if we're going to sit here and talk about it, we have to model the behavior and start doing the collaboration across the ecosystem. And I know, Janet, it sounds like you've tried to do that a lot throughout your career, but I don't know if anyone has thoughts on that and how are we doing, right? And what do you think, if you had to say, like, there are a few things, for any of you, like, that we could do meaningfully to start inflecting that? What do you think needs to happen to start bringing that together in a more meaningful way?
I think we're doing miserably.
Don't mince words.
Right. Right. I think that, we have the best of times and the worst of times in the United States. We have this, and that's what the medical schools, the large medical centers, they want that cutting edge care, your transplants, your CAR T cells, your gene therapy, or what have you.
They want the new, interesting science.
Yeah, yes. Yeah, and also they're delivering like the cutting edge of all kinds of care out there, and then they have all the rest of us. Because I don't think it's just the rural or other folks. I think much of the care in the United States is suboptimal. The physicians are and other caregivers are too pressed for time. They're dealing with the health record problems, and so forth and so on. And clinicians I have visited still have clipboards, okay? I mean, so it's like they have to use the health records and they also give you clipboards.
Some don't even use the health system.
Right.
Some of the more independent is what I found.
Right. So my theory is that really to get where we need to go to get the science really advance in the way it needs to be would be the reform of the healthcare system. And I see a lot of obstacles to getting that done.
I would say that they're bright, shining examples, but they're not ubiquitous, right? We don't see them across the country at scale, but I think that it's starting. I wouldn't say if we were like 101, 201, 301 in terms of this transformation, we're talking about we're probably at 101B potentially. But the bright shining places that I see, for example, you have the large tech companies to some extent who are now focused on this. I mean, I can throw out some examples around how do they create more of this transaction that's with transparency to consumers, treating healthcare almost like a consumer business, right? We're beginning to see that. We see the large retailers who are dipping their toes in clinical trials can you imagine a retailer that's selling just the goods and wares saying, I want to get involved in clinical trials, clinical research, because they see has to be both a business opportunity, but also the needs of the community. I also see partnerships that are forming that are fantastic partnerships, right? On food, right? Food is medicine, coupled with actually biopharmaceutical companies, coupled with care delivery, and then policies that support that. I think those are going to be very interesting going forward. I see a lot of investment that's happening in community-based research infrastructure. There's a new commitment actually by Dr. Bertagnoli, a new NIH director, to say, I want clinical trials in primary care settings. That's a great signal out to the rest of the community to move towards that. And companies that are building, there just needs to be more, right? We just need more. We need more of a groundswell. We need more resources. We just need more commitment. And for those who are entering and they're tiptoeing into the space to not exit, because we have seen some exits already as well, because of the lack of incentives.
We need the incentives there, and we need the support for people to be in it.
That's right.
For the long haul.
But what I appreciate about I mean, there are many things wrong in the U.S. Our fragmented healthcare system is abysmal, terrible, but we are also this incredible hotspot for innovation, which is fantastic. Right, when we're pressed against the wall, someone innovates.
That's right.
And we need to just be very deliberate and intentional on finding those right innovations. We talked about some of them today, and scaling those innovations. It's going to happen both through practice at the company level, but it's also going to have to happen through policy.
Esther, don't you think that has to happen with the insurers and with CMS?
Absolutely,
Yes.
we cannot
Okay.
leave them out.
Because
We
they
cannot
have to
leave them out.
enable
Yes.
this and not say, no, this isn't covered, okay,
Yes.
by. So to me, that's a big barrier to innovation, is the way that healthcare is reimbursed in the United
I
States.
absolutely agree with that. One of these moments for me was I was working with Ochsner and I was asking about those that come in on the clinical trials, and they said, well, if they don't have insurance, it's often hard to get them in the clinical trials. And that was a wake-up call for me, because I actually, in my 30 years, I did not know this.
Yes.
Okay? How did I not know this, right? And I just think that over time, our society is not going to tolerate us. In other words, they're not going to tolerate the healthcare system the way it is. They're not going to tolerate the insurers the way it is, because the next generation coming up, they demand more,
Yes.
because
They know more.
they know more. They can get it through retail, whatever. And say, why can't I have the same?
Yes.
And so whether they're in the industry, whether they're in the healthcare system, or they're going to be a consumer of the goods and services of healthcare, I just think they're going to demand more, which means it's going to put everybody on their toes to continue to evolve faster.
Yeah.
Right? Like we've seen everything like happens now, like almost at light speed, this evolution. I think we're going to start seeing this environment evolving, and it's not going to be we're not going to be able to hold it back if you want, right?
Hope so. Hope so.